Thank you. Thank you, Mum, and thank you everyone for coming today. I must say everyone looks lovely, and I haven't met many of you, so I hope I get a chance to talk to you after the presentation. And thank you very much for inviting me, Desley, to her time, and thank you for letting me share my story. So this year, over 18,000 people have been diagnosed with breast cancer. While breast cancer is commonly referred to as an older woman's disease, breast cancer doesn't discriminate, and every single day, young women between the ages of 20 and 39 will be diagnosed. On my 39th birthday, I was told I would need intensive chemotherapy, radiation, and major surgery to beat breast cancer. I didn't think that my treatment would be as long and as hard as it has been, and I thought that I'd be back at work in just a couple of months. Now, my diagnosis and treatment over the past 2.5 years has impacted many areas of my life. However, I count this journey as a blessing, and I'm very pleased to share this with you today. So, I have always maintained a relatively healthy lifestyle and never even considered the thought of breast cancer as I was under 40 years old. I had never had a mammogram, as I thought you only needed them when you turned 40. So to start my story, it was in August 2016 on a Tuesday when I showed Mum a small scar and indent that I had on my right breast underneath the wire in the bras that I'd been wearing. It wasn't painful at all, but it just got a bit uncomfortable every day, so I was always happy to take my bra off at the end of the day. Little did I know that this teeny tiny scar was hiding a big mass of hidden cancer. Mum told me to immediately go to the doctor, as we have a history of breast cancer in the family, so I made an appointment for the next day. The doctor said that the scarring was very suspicious, and he called it skin puckering. What surprised me the most was that he said there was a big, hard lump hiding underneath the skin, and it was about 6 centimetres in size. So it's quite a large lump, and I had absolutely no idea. So off I had to go for an ultrasound, and because it was so large, they fitted me in the next day. But the assistant at the ultrasound place, she was quite annoyed with the doctor because she said they can easily see this lump, but I'd need a full assessment, including a mammogram and a biopsy, to actually determine if there was anything wrong and anything to worry about. So the mammogram place and the biopsy place at the Holy Spirit Hospital in Chermside in Brisbane put me in straight away. So that was the next day as well. And then the possibility of breast cancer had suddenly become very real. So this was my first mammogram, and I'd heard so many things about mammograms being painful, but I was fortunate enough that it wasn't painful at all. The biopsy, however, was a different story and the most pain I had ever experienced, except for childbirth. So as my lump was so large, the anaesthetic didn't work the first time, and they needed to give me a few more doses of anaesthetic to stop screaming. But I was left with quite a lot of bruising across my chest following the biopsy. So the biopsy, which had now fallen on a Thursday, and then I had to play the waiting game over the weekend. And as everyone knows how trying the waiting game can be when you're waiting for medical results. This was the same weekend as my husband turning 40, so we had very mixed emotions over that weekend and only told a few of our closest friends that we were waiting for test results. I finally received the call while at home on Monday to see the breast specialist at the Holy Spirit Hospital, and then a meeting was scheduled to get the results on the Wednesday. I clearly remember sitting in the waiting room with my husband saying, "I don't think it's breast cancer because I feel completely fine." I had been playing netball that week, and only a few months prior, I'd hiked a mountain in Hawaii with one of my best friends on a holiday. So my doctor spoke to us for a bit and then dropped the bombshell. It's cancer. She went on to tell us what the next steps would be and also gave us some inspiration, saying that I could beat it because Kylie Minogue did, and so did Delta Goodrum. So now I had an invasive ductal carcinoma, a hormone-positive and aggressive cancer. In the beginning, I felt as if everything was in slow motion, but moving quickly at the same time. In a week, my life had been flipped upside down. It was all very overwhelming, but I quickly realised I needed to stop and just catch my breath. I needed to trust that God has greatness planned for me. He had never failed me so far, and I needed to trust him with this crazy cancer and choose not to worry. I began chemotherapy in September and went through till December. I had a portacath installed into my chest as I'm not very good with needles, and the chemotherapy is given through a needle in the arm if you don't have a portacath. I didn't know that this would be the start of many needles, and I'm nearly at 100 needles over the past 2 years, so yes, I feel like a bit of a pincushion. Chemotherapy has many side effects, and I'm pretty sure I experienced them all. I was on a triple dose of chemo called a T, an A and a C, which is the strongest doses you can get. A week after my first round of chemo, I could actually feel the lump changing a bit. It was getting softer, so I knew that the chemo was working, even though I had all the side effects, including nausea, constipation, diarrhoea, fatigue, joint pain, hot flashes, along with a ridiculous amount of night sweats. These were mainly due to the treatment drastically changing my hormone levels, and this has also brought on early menopause. I ended up in hospital emergency twice during chemotherapy, as the first time I had trouble breathing because my throat was swelling up. I called the ambulance and they took me to hospital, but I remember having a laugh with the ambulance officers as there was this big bug flying around in the ambulance, and so they were trying to catch it with not much luck, I might add, while I was laying there on the stretcher bed. The second trip to hospital, I had a temperature, and I'd been given an urgent medical treatment card, so I rushed through emergency into a private hospital room. This was just like the VIP treatment. But of course, I was very sick, and I was actually upset at having to have more needles to check my white blood cell count. So the doctor in charge of emergency at the time, he said, "Oh, I can make you happier. You can have some happy gas." So his team then wheeled in the biggest tank of happy gas that you ever did see. And Mum was with me and she thought it was hilarious. But I ended up being admitted to hospital as I had no white blood cell count. So I was neutropenic, and then I needed to stay in isolation for 3 days. So losing my hair and gaining weight from treatment was a very big hit to my confidence. However, the best way to deal with it was embracing the humour and having fun with my baldness. So these are images of my very first chemo session and then my fourth chemo session when I was completely bald. It took about 21 days for my hair to completely fall out. So we had to explain to our children that the medicine that was going to make me better would also make my hair fall out for a little bit, but it would eventually grow back. I lost all of my hair, including the hair of my legs, and most of my eyebrows, and the one good thing was that I no longer needed to shave my legs. That was a godsend. During this time, we tried to maintain as much normalcy in our children's lives as possible throughout the treatments. No matter how miserable I felt, I got up nearly every single morning through all the stages of my treatment and got my children ready for school, just as I always had. I asked the kids if they wanted me to wear a hat or a scarf, or if it was okay to be bald that day during drop-off because it was over summer. As I was home each day after school, my children actually excelled in their schoolwork as well as in their sports. My daughter participated in her very first year of netball at 8 years old, and not only did she take out the best and fairest player in her team, she also won the Club Player of the Year award. My son had his best year at school with his academic results, and he excelled at his sports of basketball and Brazilian Jiu-Jitsu. My last chemotherapy was on Christmas Eve. So this is a photo of my very last chemotherapy, and I was very pleased. While I was so glad to have finished, the chemotherapy and toxins had built up in my body over the past 4 months, and I wasn't really well over Christmas, but at least I was finished with chemo. So after Christmas, I had a few weeks recovery until the surgeons decided that the decision would be made to remove both of my breasts. This was a preventative surgery rather than a necessity to remove the cancer, and was made due to my age, history of cancer in the family, having large breasts, and the chemotherapy treatment, which had made the shape of my right breast very strange. My double mastectomy was scheduled for February, so in the last week of January, I took my family on a P&O comedy cruise, which left out of Brisbane. I wanted to laugh my breasts off before they got taken off. This was a nice distraction and a great little family holiday before the kids returned to school. But of course, I was bald. So I did wear a wig sometimes. So there's a photo with the wig when we were dressed up for the gala night. And then also I took a photo when I was bald. So the surgery of a double mastectomy is actually quite a simple procedure. However, I was in the public system and it was very daunting, and I was in the operations waiting room along with a number of older men who were there to have hip replacements, and here I was having my breasts removed. But it was all part of the process of my treatment and went well. I shared a ward with other women who had mastectomies as well, and I went home in a few days with no complications, although I was heavily bandaged and connected to 2 drain bags. The most difficult thing was probably the emotional part, as being a woman and having your breasts removed is something that you would never consider. But I guess it was God's plan for me, and I was okay with it, as long as it meant I could have a long and happy life. My breasts were dissected into 16 pieces, and some of my breast tissue has been sent to Berlin as part of a worldwide clinical trial for cancer research. Another part of my breast tissue is being used by the University of Queensland for blood cancer research, and I feel that this is one of the key reasons that I needed the mastectomy. So after chemo and the double mastectomy, I needed to do radiation. And to me, radiation was explained as basically a mop-up of any cancer cells that were remaining close to the chest wall and that couldn't be seen on the scans. I began radiation in April 2017 for 5 weeks, a total of 25 rounds of radiation. The monotony of going to hospital every single day was quite difficult emotionally, and my radiated skin was very burnt and quite painful. My skin was blistered and red raw, but the doctors provided some silicone dressing to soothe it a little, and I had all the lotions and potions that you could need, like vitamin B cream and aloe vera gel. I actually enjoyed getting to know the team at the Royal Brisbane Hospital Radiation Ward and enjoyed the quiet time waiting for the treatment, doing jigsaw puzzles in the waiting room. The treatment was quite quick once I'd been lined up correctly on the machine, and I got to listen to music during the treatment, so it wasn't all bad. I tried to keep up moderate exercises during that time, and I was feeling well enough to participate in the Mother's Day Classic, the 5-kilometre walk to raise funds for breast cancer research. I know many of you participate in the walk here in Tin Can Bay, and thank you all for doing so. My friends and family all got behind me, and we raised over $2,000 for breast cancer research. So to finalise my breast cancer operations, I opted for breast reconstruction. After 12 months of being flat-chested and basically wearing no bra, I was actually looking forward to having breasts again and feeling like a new woman. After a lot of consultations, my surgeons all recommended a bilateral tram flap breast reconstruction. So this is basically where they take the stomach muscles, the stomach skin and the fat, and they use this to make new breasts, as this is the most natural way to create breasts. So there's no silicone used, but I have a big cut from hip to hip. I had the best plastic surgeon from the Valley Plastic Surgery, who also used a second surgeon at the Brisbane Private Hospital, and the operation went for 8 hours. It would have gone for 14 hours if I was using a single surgeon. But fortunately for me, my oncologist had recommended I take out private hospital cover so that I could choose my surgeon for the operation. I'm so pleased I did, and I was able to schedule the date for my own reconstruction. This, however, was the most daunting operation, as there was a big risk that the flap would not work, and I had to use my faith to be strong enough to go through with it. I had hundreds of stitches across my stomach and across my chest, and a week in hospital, and I've got the biggest cut across my tummy. I had to learn to walk again and breathe again as my lungs were pushed up, and I was attached to 4 drain bags. I have a completely brand new belly button, and I now know that it takes 18 stitches to make a belly button. So during my time at hospital, I was fortunate enough that my girlfriends and family visited me at hospital. I was getting quite bored staring at the 4 hospital walls, but the nurses were angels, and so I enjoyed meeting them, and their care for me was amazing. Another amazing thing that happened during my procedure was that the surgeon used a donated piece of skin, about 20 centimetres long, from an organ donor, and used this piece as a mesh to prevent hernias. So the skin is placed in my belly before he sewed my stomach back up. I feel blessed that we have amazing surgeons and advancements in reconstructive surgery, and feel blessed that we have considerate organ donors whose organs have significant impacts on the lives of others such as me. This leads me to be thankful that I had breasts that are natural following my bilateral mastectomy. I went into the surgery with no breasts, and through the glory of microsurgery, I awoke to new breasts made of my own tissue and had a flat tummy. For this, I'm still amazed and thankful, even though all the weight has now gone back onto my tummy. So after all of these treatments and surgeries, I was feeling nearly back to normal and returned to work for a few weeks. But during the last school holidays in September, my whole arm started swelling up. I didn't think much of it at all and just tried to ice it to keep the swelling down. When it hit me, it's lymphedema. So I had to go to the doctor and start on a physiotherapy treatment plan to measure the lymphedema. And I'm pleased that it's only at stage 1. I'm working really hard with exercises to keep the swelling down and drinking lots of fluids and hot water to move the lymphatic system around my body. I quite often wear a compression sleeve to help as well. Lymphedema is a common side effect of having lymph nodes removed, but one that I was not expecting, as my mastectomy and lymph node removal was 1.5 years prior. This is a chronic disease, so it's something that I'll have to manage for the rest of my life. I'm continuing my treatment with hormone therapy, taking tamoxifen, and I'm just busy embracing life. I've always laughed and allowed myself to be silly, but cancer has taught me to be brave. Not to fear the storm, but to dance in the rain and seek the rainbows. I find myself now wanting to be more spontaneous, smiling more, living each day with even more love and laughter. I feel as though God has led me down this path to help others and encourage them through their journeys. I want everyone to know that a cancer diagnosis and treatment might not be as horrible as they initially thought. Everyone's experience is different, and I'd like to continue to share my story with other cancer patients to give hope and to ease their hearts and minds. Cancer has a way of making you look deeper into your life and reassess and prioritise. I feel blessed to have received my diagnosis when I did, and thankful that my cancer had not spread. I am thankful for amazing hospitals filled with incredible physicians who took such good care of me, and I'm thankful for modern medicine making my diagnosis something treatable. I feel more blessed than I deserve, and I'm grateful for the second chance at life, and thankful for all the wonderful people God has brought into my life through my journey over the last 2 years. I believe in learning from the difficulties life hands us along the way, and I realise now more than ever that I'm very lucky to be alive, and each day on this earth is truly a gift from God. I'm thankful to have 2 mostly healthy parents who I can count on. I can call on day or night, and I know I'll always have those 2 on my corner no matter what. I'm thankful to have a husband who supports me, and most of all, he puts up with my crazy. After 20 years together, I'm amazed that I still like him, and he continues to make me laugh. I'm extremely blessed to work for the Queensland Government and have wonderful work colleagues who have supported me through all of this. My job has been kept open for me, and I have up to 3 years medical leave available. I realise not all of us are so lucky, and I'm truly grateful to work for such a great organisation who continue to pay me through income protection payments, making the financial burden of cancer treatment so much easier on my family. I recently returned to work but had further minor surgery, so now I'll go back in January when the kids go back to school. I'm blessed to have my children. I realise that raising 2 little ones is not only the most challenging but most enjoyable task I've ever taken on. I'm so thankful that I was able to have them before my cancer journey, and they've been such a huge inspiration to fight and be strong through all of this. I'm now so much more aware of what I'm putting into my body as well. I've learned that I had blindly been filling my body with toxins and promoting cancer growth for years. I love food, and so there are still plenty of splurges. But for the most part, I'm eating all natural, organic foods. I've reduced my intake of processed sugars and flours immensely. I'm still learning and have a long way to go and continue to make changes, but feel confident that I'm on the right path. Every day is a gift. It's so important to appreciate and embrace the little things. I know what it means to stay positive in the face of adversity. As strange as it sounds, I'm honestly grateful to cancer for providing me a new perspective and for bringing so many wonderful people into my life. It's been a tough road, but it's my road, which has made me the person I am today, and for that I am truly blessed. Thank you. Thank you.